Hello and welcome to a new episode of Majlis podcast by Emirates Hospital Group. I'm Wael Berro, family medicine consultant at Emirates Specialty Hospital. Today we're going into the field of aesthetic gynecology, and who's better than my guest today, Dr. Nurgul.
Hi, I'm Dr. Nurgul, a consultant gynecologist on obstetrician with a German board certification. I work in Emirates Hospital Jumeirah and Motor City branch. I moved to Dubai 12 years ago with my husband and my wonderful two daughters. And now it was a decision that opened for me new doors, I can say. And now I'm here working with women from across all stages of life. And I can say, from their first pregnancies to menopause. And I'm really enjoying it, helping them feel comfortable and normal again after, when they had a childbirth or after menopause. So this is my aim, to help this woman to feel their bodies again.
Perfect, and I'm glad, and I'm sure actually you're doing a great job about it, and I'm glad to have you here as a guest today, because we're going to talk about a topic that is not very well understood, even probably among doctors. So we hear the word aesthetic gynecology, and sometimes we think mostly cosmetic, but I'm sure it's more than that. I'm sure there's the functional part, the well-being part. Tell me more about it, please.
To be honest, the word aesthetic, I don't like to say more aesthetic. I like the word functional and reconstructive, regenerative gynecology. So here we want to fix a problem. For example, if the woman has some structural anomalies and is not well in her body, and she has really suffered a lot throughout the years, and I'm here to help this kind of woman to feel themselves again, to get back to their self-esteem, confidence, whether it's through postpartum care, hormonal issues, or aesthetic gynecology. And I try to help them to feel themselves again, to have a good connection to their partner again, to feel self-confident and normal again in their bodies.
So, if I may ask, and from a very kind of lay person point of view, what are the types of patients? I know, of course, they will be women, but what would be their presentation? What are the symptoms that they might have that they should seek your expertise?
That is a good question. Many women can suffer with severe dryness, laxity after childbirth, for example, or when they're going through menopause. They have hormonal issues and problems. Of course, this affects also their relationships. And we are trying to fix it. I try to fix it, by explaining them what is the main issue. When there is a hormonal issue, we will give them a hormonal treatment and support. If it's more structural anomaly issue or a birth defect, for example, they have an episiotomy defect or a tear that they have non-healing tear. This we try to address, and we try to help the patient by informing, explaining in detail to fix this problem, not only from the aesthetic part, also from the functional and reconstructive part. And especially women when they're going through menopause, we cannot just fix with one device or one surgical treatment. We have to tell them that they need hormonal support, hormonal treatment, and here we can do a lot. And there is a wide range of treatment options.
Of course, and it is actually a very complicated process to control the hormones, because I know they differ from one individual to another, and I'm sure your approach is individualized or personalized. But you mentioned procedures along with the hormonal treatment. So what sort of procedures, what sort of surgical procedures would I expect if I were a patient coming to see you?
First of all, I will not talk about surgical procedures. First, there are options of non-surgical options and surgical options. If I start with non-surgical options are, for example, laser radiofrequency treatments or some other treatments like PRP, which is called plasma, platelet-rich plasma. Yeah, and here we can give them the opportunity for a non-surgical approach. They can figure out, we can discuss the treatment option and how they can get this treatment in a safer way without any invasive treatment. Here we can decide if there is any severe condition or any mild condition. For example, if this patient is suffering from a mild to moderate stress urinary incontinence, we can go for non-surgical options or hormonal treatments as well. Or when there is a surgical option needed, when there is a severe case, for example, severe prolapse, for example, this we need to fix surgically. And we have to explain them in detail and talk with them openly and honestly, and of course we have to address the expectations as well. We have to be very realistic and to find the best solution, the safest way to treat. So as I told, there are non-surgical and surgical options, and there are a wide range of treatment.
Which is fair enough, actually. That's the case in every discipline, medicine. But Dr. Nurgul, if I were to ask, like you mentioned, stress, incontinence, and prolapse, what common conditions and what sort of treatment options would have? If you would name 3 for us, for example, for our audience, just so that they can have a feel of the specialty itself.
If they especially are suffering from urinary incontinence, of course, in addition to Kegel exercise, we can tell them you can get the laser or radiofrequency treatment. It depends on which age they are. There are some, after postpartum can be a problem, or they are going through menopause and they have very dry skin and very thinning and painful intimate area. Here we can give different kind of treatment options and discuss what is the best option to help.
Fair enough. So I'm going to talk to Nurgul, the person now, the mother. You said 2 daughters. And you have vast experience across different continents.
Yeah.
Tell us something personal, something about you that could have happened during your training as a doctor or as a mom that you, I won't say you like to share with our audience, but maybe let's push you a bit and then share it today.
You mean a nice story about?
Yeah, if you want to say something nice, something funny that happened in your experience, just, it's nice, it's a good idea to break the ice and then move away a bit from the always go talking medicine.
There is one story I would like to mention. I had a patient, she was really suffering for many years, and she had after birth a large episiotomy scar and defect, not a scar, it was a defect. And I was really surprised why she didn't come forward earlier. So she was so busy and mom, and she had a really high demanding work life. And after really explaining and encouraging, I reassured her and I give her some tips and that we can fix this in one day. So this immediate results when we did the surgery, and she had the immediate transformation because she was suffering a lot from, the intimacy relationship was really a problem, and she couldn't feel her body herself again. And she had a lot of anxiety and worries. So I tried to discuss with her and reassure her what are the surgery techniques are and how fast we can get good results. So and after the procedure was done, and she was really, really transformed and happy, I can say, I saved her life. So she had her life back, and it was a very emotional moment, I can say. And this makes me happy too. When I see my patients happy, I did good work, and this is where I can say
I'm
really,
happy to hear that. And sexual health, unfortunately, is always kind of, people are always reluctant to talk about it, to bring it up with their doctors. And I admit, even as us as family doctors, sometimes we don't mention that. We talk about every system in the body except this. So I'm glad you're here to help those women address those issues. Now, like every field in medicine, again, things are moving. We keep evolving. Things that we were doing 5 years ago, sometimes a year ago, it's not anymore the case. What are the most recent advances that in your practice, and what actually is happening? What is there behind the scene that to look forward to in the future?
As I told you, we have this new innovative technology like this laser and radiofrequency treatments and PRP, as I mentioned before. These are they have really potential effectiveness, and we have some studies, multiple studies about efficacy. And of course, we have to do more. We have to have more research about it. We need more randomized control studies to really have a full backup. And we have to mention that to the patient. We have to explain them, they have some improvements. They have to keep on maintaining this with these treatments. And of course, additional medication with, like I told you, with a hormonal treatment, also here pelvic floor exercise in case of stress urinary incontinence, or if there is a severe dryness or laxity. Here we have to add especially lubrication, also hormonal treatments, and there are so many things we have to address. And I'm very happy that we have these new innovative treatment options, which we didn't have many years ago. So we are going forward with the research. We are approaching this field. That's why I like this. I don't like to say aesthetic gynecology. I like to say it more this functional or regenerative gynecology. We want to bring life back. We want to approach holistically to be normal again and to help women, even if they're very shy, they cannot come forward. It's a taboo topic, taboo. We are saying that in German. I don't know if it's in English the same. So they should open up and they should discuss the main problem reason, and we can help. And there's so many work to do still to approach this kind of person, a woman, when they're really suffering from these issues. And there are some specific cases I can mention just shortly. It depends also from what kind of cultural background they're coming from. And psychologically, they're really, really affected as well. And sometimes, partner relations are also affecting a lot. This we need to address. We have sometimes at the psychological support as well to really help the person. Not only this intimate area is important, the full patient and her problems, something more emotional and psychological. The aspect is there.
So you mentioned all these procedures and the PRPs and the laser. I'm assuming definitely you have access to this at Emirates group, and especially at the clinic where you work in Motor City.
Yes, we had so many devices. We had contact to people there could provide these machines and specific devices. For example, the laser technology, we could work with that. And also we have this new technology with all 3-in-1 work, like it's for electromyostimulation, biostimulation, and there is some microcurrents in this device, so I don't want to mention the name of the machine, but we had really good effects and patient feedback was really good because during this procedure they could feel how we could train the muscle down there in the pelvic floor. And when they can add an addition, for example, PRP can help with regenerating, help with healing. And in addition, when we can use machines which are multifunctional, it's amazing. We have amazing results. But of course, it's not from the first session. We have to tell them you need multiple sessions, back to back. And sometimes you need also maintenance. Like, training a muscle, if you don't train anything, it will go back to the old previous condition. So continuous work on that, plus, again, hormonal treatment, plus supportive emotional discussion. What we can improve best, it's the key of the treatment.
Perfect. So the next question then would be regarding safety. Now, as a patient seeking expert help, I will come to someone like you. You're highly trained, you're experienced. Unfortunately, sometimes I cannot see you. I might have to see another colleague. What are the criteria as a patient that I should consider? Because safety in medicine is key. I mean, we cannot go to any clinic just because someone put a sign. What do you advise the audience in terms when it comes to any functional gynecology, I would not say aesthetic, what are the criteria they should consider when it comes to safety and expertise of the practitioner?
Thank you. This is a very important question. Safety is always what comes first. I will tell my patient, look, first make sure the doctor has a certification in his training, especially in aesthetic gynecology and procedures. Then look for additional training sessions the doctor went through or fellowships, and ask for how many times they perform the procedure. And you can also tell them if the doctor is really taking time, explaining the procedure well in detail, the risk, benefits, and also your expectations. Is it fulfilling your expectations? They have to be more honest and realistic, Not every patient has indication for a treatment. We have to make sure if she has any underlying condition, for example. And of course, it have to, the facility is important. It have to be a licensed, clean, and well-equipped medical facility. And when the patient is addressing these important points and check, then they're in the best way. This is the safest. And of course, the trust is important. They have to trust their doctor, and the doctor have to take extra time to listen and to address their problem. And here's some, of course, we have to talk also about contraindications and reason when we should not go through these treatments.
And I think, again, I keep saying the same, it's like every other specialty. I'm always surprised whenever a patient comes to see me. It's like, oh, I've been with this doctor for 5 years, but I don't like them because I feel they judge me or they don't have time to me. And I'm always surprised, like, how come you kept going to the same doctor? And to me, especially in a place like Dubai, we have access to high quality doctors and trust, comfort, non-judgmental, plus the expertise that you mentioned. Thank you for this. Now, I know you answered it very briefly, but I want kind of to put in summary because we're talking about the medical aspects of these conditions, but you highlighted briefly the importance of the non-medical benefits, whether psychological, the impact on the intimacy, on my happiness and the happiness of the couple. And like you mentioned, when you talked about the personal story you shared, you said the word saved her life, and probably I would say saved her marriage. So tell us more about these extra benefits, please.
So the extra benefit is, when they have these relationship issues, because there is a condition like a physical problem. Physical problems we can fix, but at the same time we can fix their self-esteem, confidence, and the connection to their partner. And this is also an important point. So if their life is back, like they have again connection to each other, and this will fulfill their life.
Now, you mentioned the conditions that we have to cover. You mentioned the patients that could come to see you. But I'm sure there are contraindications because, like we said earlier, every person is different. They might have other comorbidities, so other diseases, or they might have certain conditions that might say contraindication or not allow them to proceed with functional gynecology treatment.
Of course, here is very important how you select your patient and which symptoms they have. So number one, if the patient has high expectations and it's not realistic, so we cannot do the procedure on that patient. And if there is someone who is suffering from body dysmorphic disorder, for example, this is a medical condition where the patient is thinking a lot over and over again about her appearance and look, and in fact there is nothing wrong. Or there is a condition, medical condition, for example, there is uncontrolled diabetes, or there is an autoimmune disease, or they're taking blood thinning medication. These kind of things we have to rule out first. Or, of course, not in pregnancy or during breastfeeding. Some we can do, some procedures we cannot do. And these are important information we have to ask before we are going through a procedure, of course, and treatment. And most important, if there is a fresh infection or any open wound, of course, we have to wait until the healing is over. For example, after birth, they have episiotomy or a tear. This needs to heal first before we go with the treatment. And patients, when they have scar tissue abnormality or skin disease, underlying skin disease, first I would say she have to consult a dermatologist, and then we can look forward to see if this treatment is really suitable for this patient.
These are priceless but yet not measurable benefits. So I'm sure those are very important and unfortunately sometimes undervalued because we overlook them. Of course,
yeah.
Dr. Nurgul, it was a pleasure to have you over today. It's a very nice topic to talk about functional gynecology. I learned a lot on a personal level because to me, even as a doctor, I'm not exposed to that. So maybe I should come shadow your practice and learn more about your work.
Thank you.
Any take-home message for our audience today when it comes to functional gynecology, and what do you advise them to do?
So my advice always, don't feel shy. Come forward with your problems. Don't suffer many years, and talk openly to your doctor. Choose your doctor wisely, and we can help. We can discuss everything and give you many options of treatment.
This brings our episode to an end. Thank you very much for listening, and stay tuned for a new episode of Al Majlis podcast by Emirates Hospital Group very soon. Dr. Nurgul, thank you again.
Thank you so much.